Craig Duffrey takes good care of himself. He works out daily, eats right, and has no weight or health problems. Though he's only in his mid-40s, he and his wife both purchased long-term care insurance years ago when they were in their 30s.
No one likes to think about getting older, but it is a fact of life.
In fact, the Healthcare Financing Administration reports that 40% of all people who reach age 65 will spend some time in a nursing home. And more baby boomers like Craig are becoming aware of the need for long-term care as they help their own aging parents.
Well, everybody hears about the sandwich generation, and I saw it with my own parents. They took care of my grandmother when she was older, and unfortunately she was ill at the time as well, so it was a real strain for them. And my brother and I were still growing up, and we were concerned about what might happen to us and then to our children if they needed to take care of us.
For less than $20 a month, Craig has peace of mind knowing his future care needs will be provided for, since he bought a long-term care policy from MetLife more than 10 years ago.
Well, we feel great. We know we're protected. We know our children are protected, and that's a real concern to us. But it's now something we don't have to worry about. We're protecting our assets as well as our health.
Although many people assume their health insurance will take care of all their future care needs, the fact is, for the most part, long-term care is not covered by health insurance, Medicare, or Medicare supplement insurance.
Long-term care is the greatest uninsured risk in America today, and most people don't realize that. But without some sort of insurance to pay for long-term care, should you need it, your entire retirement portfolio is at risk.
Long-term care today does not necessarily mean a nursing home. It can be assisted living or even home care. One thing it is not, though, is acute medical care.
Long-term care is really custodial in nature. It's the type of care that a person would need who needed help with bathing, using the toilet, or perhaps cooking.
So in the absence of insurance, who pays the bills for long-term care? Unfortunately, for everyone except the very poor, the people who need the care or their families are the ones who are paying the bill. And at an average cost of $55,000 a year, nursing home expenses can easily wipe out a family's resources. Denise Talbot White is finding out the hard way what Medicare does and does not cover after her mother Alice took ill in May of last year.
I've kept a binder of all of the paperwork since May. These are the bills that I'm paying. This one is $6,826. This one is $5,000. These are all Medicare statements. They're not bills, and they're not things telling me that these charges are paid. They're telling me that they are charges that we are going to have to pick up.
Ironically, even though she didn't purchase it at a young age, Denise's mother had the opportunity to purchase long-term care insurance in her late 70s, but she felt she couldn't afford it.
It probably would have cost her $3,000 to $4,000 per year, as opposed to the checks I'm writing out now, which could be $4,000, $5,000, $6,000 per month.
Denial is a big factor in failing to plan for the future, especially among the baby boomers, a generation who refused to grow up and who are now refusing to grow old. As a gerontologist, Dr. Sandra Timmerman studies aging and related concerns.
There are actually about 76 million boomers, but believe it or not, the oldest ones will now be age 55, and they just don't really want to think about growing old. And of course, if you feel that you're never going to get old, you may think that you don't need to save money for your retirement. But in fact, there are a number of reasons why you have to. For one, we're going to live much longer, and I think we'll be healthier as a group. But if you're expecting to be retired at, say, 60 or 65, and you live to be 100, you could have 40 years in retirement.
In fact, the fastest growing segment of our population is people over the age of 85. And although many are indeed healthy, active, and vital, many others will need long-term care.
It's important for people to plan for long-term care as young as possible. What I say as a rule of thumb is you should start thinking about it by the time you're 40. If you haven't bought it by the time you're 50, buy it. And if you're over the age of 50, you should definitely buy it now.
The earlier you buy long-term care insurance, the less it will cost you, both annually and over the long run, since the rate is based on your age at the time you buy it. For example, the same MetLife long-term care insurance policy that cost you $345 per year at the age of 40 would cost you $491 a year at 50 and $960 yearly at 60. But when you consider the average cost of long-term care at almost $5,000 per month, the cost of long-term care insurance is a bargain at any age.
The reason it's important to plan for this as early as possible is because the cost of the insurance is based on the age when you purchase it, and also it's medically underwritten, which means we take a look at your health status. So just as you wouldn't be able to buy house insurance if your house had just burned down, it's a similar concept here.
When a crisis occurs, as it did for Denise's mother Alice, it's too late. Now her entire estate is at risk, dwindling away daily due to nursing care bills.
This was the last thing she wanted, and she, by trying so hard to avoid it, to be in denial that it might never happen to her, the exact thing that she feared is happening.
If you're already in your 60s, like retired flight attendant Jeannie Covesi, it's not too late to plan for the future.
I'm on a fixed income for the first time in my life. When I was a flight attendant, if I wanted extra money, I'd fly an extra trip. Never worried about, never really thought about the future. Well, I didn't have time. I was a single mother with 3 kids.
At 66 years of age, Jeannie bought a long-term care policy offered by MetLife and found that although it cost more at her age, she could still easily fit it into her budget. And being on a fixed income, she watches every penny.
Now that I'm by myself, I find myself not buying things on impulse. I have to stop and reconsider. Lettuce, for example. A few months back, lettuce was going for $1.29. And I said, I don't like lettuce that much anyway, so I can do without lettuce.
Though she wishes she'd bought it 20 years ago, Jeannie feels her long-term care policy is worth every penny.
I sleep better at night for the simple reason I do not ever want to be in the position that my children have to take care of me. I had to take care of 3 elderly relatives, and I know all the pain and the anguish and the expense, and I just could not put my children through that.
And Jeannie can also rest assured her benefits will be there should she need them, because MetLife has been in business for more than 130 years and has been rated A+ by an independent rating agency. Additionally, MetLife has registered nurse care advisors on staff to help families in need when and if